If you carry ApoE4, what you eat today could determine whether you develop Alzheimer's tomorrow. But here is what shocked researchers at the AAIC 2025 conference. It's not just about the food, it's about the trillions of bacteria in your gut that are literally communicating with your brain right now through what we call the gut-brain axis, producing neurotransmitters and metabolites that cross the blood-brain barrier. In the next 15 minutes, you're about to discover how 5 groundbreaking studies just revolutionized our understanding of diet, gut health, and cognitive aging. And if you're one of the 25% of people with 1 copy of ApoE4 or the 2% with 2 copies like me, this information becomes even more critical. Hi, I'm Dr. Kevin Tran. I'm a doctor of pharmacy and an ApoE4 carrier. I'm also the founder of the Phoenix Community, a platform dedicated to helping ApoE4 carriers beat the odds and outsmart Alzheimer's. Through my personal journey with ApoE4, I dive deep into the latest research and translate complex findings into hopefully clear, actionable insights we can apply today to take control of our brain health. So today's conference session is very exciting. It brought together 5 leading researchers who each uncovered a different piece of the diet-brain puzzle. From the gut bacteria that protects our neurons to the specific food that slow brain shrinkage by 20%, these findings are not just about hope. They actually provide a roadmap for action you can take today. What makes these discoveries particularly exciting for us as ApoE4 carriers is that several studies specifically examine how our genetic status affects these interventions. The results might surprise you. All right, let's start with Dr. Yannick Jo Wadop Nguongo from the Glenn Biggs Institute, whose research just revealed something remarkable. Cardiovascular health metrics directly reshape our gut microbiome in ways that protect cognitive function. So if you have heard about the Life's Essential 8, which is the American Heart Association's framework for optimal cardiovascular health, this includes diet quality, physical quality, nicotine exposure, sleep, body weight, cholesterol, blood sugar, and blood pressure. Each component is scored and averaged to create an overall health metric. But here's what this researcher discovered that changes everything. These cardiovascular markers don't just protect your heart, they actually fundamentally reshape your gut microbiome composition. So his team analyzed 781 middle-aged participants from the Framingham Heart Study using RNA sequencing targeting the V4 region to identify gut bacteria and measuring cognitive function through 4 different tests. So the trail-making B for executive function, logical memory, visual reproduction, and similarities. And what they found contradicts decades of assumptions about heart and brain health being separate systems.
The higher adherence to Lafayette 8 was associated with an increased abundance of Varicella and an increased abundance of Pneumococcal. The higher adherence to Lafayette 8 was associated with a decreased abundance of Clostridium from Lasinospiraceae.
So these aren't just random bacteria. Eubacterium and Oscillobacter produce short-chain fatty acids like butyrate and acetate that cross the blood-brain barrier and reduce neuroinflammation by modulating microglial activation. Meanwhile, Prevotella and Streptococcus trigger inflammatory cascades through lipopolysaccharides production and pro-inflammatory cytokine release linked to cognitive decline. But the breakthrough actually came when Dr. Nguongo teams who discovered these bacteria aren't just bystanders, they are actually active mediators.
We found that the higher adherence to Lafayette 8 seems to increase the abundance of Varicella and Pneumococcal, which consequently increases the scores of composite cognition. Some of these overlapping taxa facilitate the relationship between higher adherence to Lafayette 8 and better cognitive performance.
This is the first evidence that gut bacteria actively translate cardiovascular health into cognitive protection. And when the team analyzed which components of Life's Essential 8 matter the most,
our findings shows us that the diet, the nicotine exposure, and blood glucose contribute more to this association.
Well, for us ApoE4 carriers, it means our dietary choices and blood sugar control have an amplified impact through our gut microbiome. The protective bacteria identified in this study could be particularly crucial for us given our increased vulnerability to neuroinflammation and compromised blood-brain barrier integrity that ApoE4 confers, unfortunately. Now let's turn to Hui Chen from Zhejiang University, whose decade-long brain imaging study provides the most compelling evidence yet that the MIND diet, so Mediterranean DASH intervention for neurodegenerative delay, physically preserves brain structure. So the MIND diet, which stands for Mediterranean DASH intervention for neurodegenerative delay, combines elements of the Mediterranean diet and DASH, dietary approaches to stop hypertension diet, but was specifically designed in 2015 for brain health. It emphasizes 10 brain healthy food groups, including green leafy vegetables. Basically, you need to have 6+ servings per week, berries for around 2+ servings per week, nuts, whole grains, fish, beans, poultry, olive oil, and actually wine in moderation, while limiting 5 harmful groups, including red meat, butter or margarine, cheese, and that made me very sad because I love cheese, pastries and sweets, and fried and fast foods. So the diet scores range from 0 to 15 points. So Chen's teams followed over 1,600 participants from the Framingham Offspring cohort for a median of 3 MRI scans across a decade. So the participants' average age at baseline was around 60, which is usually a critical window for intervention. Of course, if you've been following my videos, you know the earlier you start interventions, the better. And here's what the brain scans revealed.
The highest adherence of the MIND diet was associated with around 20% slower decline in gray matter. The MIND diet, the highest tertile, was associated with about 8% of the slower expansion in lateral ventricle volumes.
So let me translate what this means. Gray matter contains our neuronal cells bodies, the dendrites, and synapses responsible for processing, memory, and decision making. It's where the actual computation happens in our brain. So the lateral ventricles are the cerebrospinal fluid field space that expand as the brain atrophies, serving as an inverse marker of brain volume. A 20% slower decline in gray matter and 8% slower ventricle expansion represents approximately 2 to 3 years of preserved cognitive function based on typical aging trajectories. So what's particularly fascinating is the trajectory over time.
At baseline, there does not seem to be very strong separations between the tertiles of the MIND diet score, but during the follow-up, those with higher diet score tended to have slower decline in gray matter and slower expansion in lateral ventricle volumes.
So this tells us something crucial. The MIND diet's benefits compound over time. You won't see differences on an MRI after only a few months, but stick with it for years and the protection becomes dramatic. Chen's team also identify which specific food drive these protective effects.
The primary contributors in the MIND diet included the berries and poultry, which were individually associated with a series of changes in brain structural markers. The sweets and pastries seem to have detrimental effects on brain health or faster atrophy.
So berries, that's the answer. Particularly blueberries and strawberries. Those are rich in anthocyanins and flavonoids that cross the blood-brain barrier and reduce oxidative stress by basically scavenging the reactive oxygen species and upregulating endogenous antioxidants enzymes. So the surprise finding is also about poultry that likely relates to its role as a lean protein source replacing red meat, which contains saturated fats and heme iron that promote neuroinflammation. Meanwhile, sweets and pastry accelerates brain shrinkage through advanced glycation end product that we call AGEs and blood sugar spikes, triggering insulin resistance and systemic inflammation that is measured by an elevated C-reactive protein in your blood. So before we dive deeper into the gut-brain mechanisms, let's address a critical real-world challenge. So Dr. Jasper Bengal from the Western University presented the BioMIND study, which tackles a problem every potential Alzheimer's patient face: diagnostic delays that can destroy any chance of successful treatment. His team's finding overturned conventional medical wisdom about specialist assessment.
What was very interesting is, despite the specialist having assessed this patient, the evidence of pathological AD was almost identical at 63%. So whether we waited for the specialist or we didn't wait for the specialist, you had almost identical identification of patients who might have pathological AD.
So this is very important. A simple biomarker test identifies Alzheimer's pathology just as accurately as seeing a specialist. But here is the critical difference.
The average wait time for Group A referral to results, 250 days. The average wait time in Group B, 712 days. So it's a difference of 413 days. You're not getting any effect from a DMT if you're waiting that long.
462 days, over a year of continued brain damage while waiting for a diagnosis. So for us ApoE4 carriers who may develop amyloid pathology 10 to 15 years earlier and actually progress faster due to reduced amyloid clearance and increased aggregation, these delays could mean missing our therapeutic windows entirely. So Dr. Bengo's real-world data also challenges clinical trial assumptions.
In the real world, about 21% of the patients that we have sent to our clinics have early AD or MCI, which is higher than we expected. It's lower than in the published cohorts. That's very important for us to think about when we start trying to interpret these in terms of positive predictive value and negative predictive value.
This lower real-world prevalence means screening strategies need refinement, especially for high-risk group like us ApoE4 carriers. The team also found practical challenges with current biomarker collection.
And we were able to successfully perform lumbar punctures in 75% of them. 3 were from failed attempts, and 5 were because they were on either anticoagulation or they had anatomical considerations, such as severe lumbar stenosis.
So this 25% failure rate for spinal fluid correction underscores why blood biomarkers like p-tau217 represent such a breakthrough for accessible testing. We have covered that in actually our previous video. So p-tau217 shows 94% accuracy in detecting brain amyloid pathology and correlates strongly with CSF markers while being increasingly available through commercial laboratories. Now we come to findings that hit particularly close to home for our community. So Dr. Warnakula Surya Fernando from the Edith Cowan University in Australia conducted the first study examining gut microbiome changes at the preclinical stages of Alzheimer's. This is before any symptoms actually appear, with a specific attention to ApoE4 status. And her team made a groundbreaking discovery.
We also identify 16 significant species at preclinical stage. This has not been reported previously. We have seen that most of the beneficial significant species belong to the amyloid beta lower group.
So these 16 species, identified through shotgun metagenomic analysis rather than just 16S sequencing, represent potential early intervention targets. So bacteria we could modify through diet or probiotics before brain damage begins during what's called the preclinical phase, when biomarkers change but cognition remains normal. But here's where it gets personal for us ApoE4 carriers.
Some of the beneficial bacteria are higher in the ApoE non-carriers versus higher beneficial bacteria in the ApoE non-carriers. ApoE carriers has a different bacteria and different presentation of organisms.
We ApoE4 carriers, and while the study didn't differentiate between those of us with 1 or 2 copies, well, we have fundamentally different gut microbiome composition. We start with fewer protective bacteria producing beneficial short-chain fatty acids, which may partially explain our increased Alzheimer's risk through reduced neuroprotection and increased neuroinflammation. So the research also revealed important sex differences.
Based on the sex also, we saw some differences at the preclinical stage. The female has seen a low amount of firmicutes but higher amount of bacteroids in the female group. We also saw higher amount of firmicutes in the male group.
So Oscillobacter and Eubacterium, the same protective bacteria Dr. Wongo identified earlier, show sex-specific patterns. Oscillobacter produces butyrate, while Eubacterium produces both butyrate and propionate. This might explain why women face 1.5 to 2x higher Alzheimer's risk, especially women who are ApoE4 carriers who face this compounded vulnerability. Age, of course, also plays a crucial role in our gut bacteria composition.
In the middle group, we have seen more firmicutes. Firmicutes are beneficial bacteria that are important to produce beneficial microbial byproducts. We saw higher amount of firmicutes in the middle group.
So middle-aged adults, roughly ages 45 to 65, so let's say not young but not elderly either, have the highest levels of these protective bacteria. This suggests an optimal intervention window that aligns with when many of us learn our ApoE4 status through genetic testing or when preclinical changes typically begin. But how exactly do gut bacteria protect the brain? Dr. Fernando's mechanistic studies provide this answer.
Sodium butyrate treated reduced the pro-inflammatory cytokines IL-6 and IL-8 while restoring anti-inflammatory markers IL-4 expression, particularly in spontaneous cultures. We also observed significant upregulated antioxidant enzymes such as CAT and the G6PD, and also rescued MFN1 expression, indicating improving mitochondrial integrity.
So butyrate, this is a 4-carbon short-chain fatty acid produced by beneficial gut bacteria through fermentation of dietary fiber. This directly reduces neuroinflammation and reduces pro-inflammatory cytokines IL-6 and IL-8. Those are the ones you could actually have tested in your blood, while increasing anti-inflammatory IL-4. It also improves mitochondrial function by upregulating MFN1, which is the acronym for mitofusin-1, which controls mitochondrial fusion. For us ApoE4 carriers who face increased neuroinflammation and mitochondrial dysfunction due to impaired lipid metabolism, optimizing butyrate production through our gut bacteria becomes really important. Dr. Fernando's team also examined common probiotic species.
The lactobacillus and bifidobacteria are the most important probiotics. In the amyloid beta lower group has a higher amount of lactobacillus and bifidobacteria than in amyloid beta high group.
So people with lower brain amyloid, basically below 20 centiloids on a PET imaging, naturally have more of the exact bacteria found in probiotic supplements. Though these represent less than 1% of our total gut bacteria. This provides biological rationale for probiotic intervention, especially for us ApoE4 carriers who start with depleted beneficial bacteria and may benefit from targeted supplementation with specific strains. Our final presenter, Dr. Diandra Denier-Fields from the University of Wisconsin, connected all these different dots through metabolomics, which is the study of small molecules in our blood that reflect what we eat and how our body processes it. So her team analyzed over 1,100 metabolites in blood samples from participants in the Wisconsin Registry for Alzheimer's Prevention, which is a cohort where roughly 40% are ApoE4 carrier like us, compared to the 25% in the general population. So we were slightly overrepresented. Using untargeted mass spectrometry and the Metabolon platform, they identified 72 metabolites significantly linked to the MIND diet after false discovery rate correction and group them into principal components to identify patterns. So the connection to p-tau217, which again is one of the most accurate blood biomarkers for Alzheimer's pathology, was striking.
For p-tau217, there were significant associations with PC1, which was the amino acids and nucleotides, PC3, which was the MIND diet components, and then PC4, which is the sphingolipid. The p-tau217 explains 20% of the variance, which is more what we expect for lifestyle factors.
So 20% of the variance of p-tau217 was explained by diet-driven metabolites. That's remarkably high for a lifestyle factor when genetics typically explain 60 to 80% of Alzheimer's disease risk. It means that what we eat measurably impacts our brain pathology markers at the molecular level. So the omega-3 and plant compound patterns showed even stronger association with neurodegeneration markers.
For both GFAP and NFL, we see consistent associations with PC2 and PC3, which reflect the omega-3 fatty acid pathway and plant and gut-derived compounds. These models explain 22% of the variance, 29% of the variance for GFAP and NFL respectively, suggesting that these dietary linked metabolite patterns are meaningfully related to neuroinflammation and neurodegeneration.
So GFAP, which is gliofibrillary acidic protein, measures astrocyte reactivity and neuroinflammation. So astrocytes become reactive in response to brain injury or pathology. And by the way, this is why it's so important to make sure that you never sustain any head injury. So no combat sports whatsoever for us ApoE4 carriers. So NFL, which is the acronym for neurofilament light chain, indicates axonal damage and is elevated in multiple neurodegenerative conditions. The fact that diet-driven metabolites explain 22% and 29% of the variance respectively in these markers demonstrate the profound impact of our food choices on brain health at the cellular level. And the specific omega-3s matter.
PC2 was linked to the fatty acids, including the omega-3 pathway. This included DPA, EHA, DHA, and also stearidonate. PC3 was related to plant-derived compounds like beta-cryptoxanthin and gut microbiome metabolites.
So you have DPA, docosapentanoic acid, EPA, which is eicosapentanoic acid, and then DHA, which is docosahexaenoic acid. So those are the marine omega-3s from fish that comprise up to 40% of brain fatty acids, along with stearidonate from plant sources like hemp or eucaryum oil, create a metabolomic signature linked to brain protection through reduced neuroinflammation. Beta-cryptoxanthin, a provitamin A carotenoid found in orange vegetables and fruits like sweet potatoes and citrus, represents the plant compounds that work synergistically with omega-3s to combat oxidative stress. So don't forget to eat your carrots. But not all dietary fats are protective.
PC4 sphingolipids was included in this pathway, and there were multiple sphingolipids, all of which are linked to increased risk of AD, this link between sphingolipids and AD.
Sphingolipids, complex lipids elevated by dairy and egg consumption, as well as soybeans, associate with increased Alzheimer's risk through their role in amyloid production and neuroinflammation. So this is actually new for me because I used to drink a lot of soy milk, and basically multiple sphingolipid species were identified in the harmful pattern. This adds crucial nuance to dietary recommendation. Not all traditionally healthy foods work the same for brain health, especially for us ApoE4 carriers. Now, I know what you're thinking. I mentioned eggs here for the sphingolipids. I actually haven't done the research. I am a big egg eater, and I believe they're fine to eat for us, but this research makes me feel like I should dive deep into it before downing my regular 3 to 4 portion of eggs every day. All right. Let's conclude now. These 5 presentations paint a remarkably consistent picture. Diet shapes our gut microbiome composition and diversity, which produces metabolites, including short-chain fatty acids, neurotransmitters, and anti-inflammatory compounds that directly impact brain health through the gut-brain axis. For us as ApoE4 carriers, this pathway becomes even more critical because we start with microbiome disadvantage, basically fewer beneficial species and reduced diversity, but can probably achieve greater benefits from targeted intervention. The convergent findings suggest a multi-pronged approach. First, adopt the MIND diet with special emphasis on berries, leafy greens, and omega-3s rich fish, while minimizing sweets, pastries, and potentially moderating dairy intake due to sphingolipid concerns. The decade-long Framingham data shows this could slow gray matter decline by 20%, which is significant, and lateral ventricle expansion by 8%. Second, you want to optimize your life's essential 8 metrics, particularly diet quality, blood sugar control. So basically diabetes is super big risk factor for Alzheimer's, and absolutely avoid nicotine. So those researchers' data show these 3 factors contributed most to microbiome changes. These directly shape your gut microbiome towards protective species like Eubacterium and Oscillobacter that produce beneficial short-chain fatty acids. Third, consider targeted probiotic supplementation with Lactobacillus and Bifidobacteria strains, especially if you're an ApoE4 carrier with naturally lower level of these protective bacteria. Dr. Fernando's data showed people with low brain amyloid had higher level of these specific probiotic, though they comprise less than 1% of the total gut bacteria. Fourth, if you are middle-aged and looking at the data from this YouTube channel, most probably are, you are in the optimal window for intervention when beneficial bacterial levels peak, especially Oscillobacter, which produces butyrate. So don't wait for symptoms, but I'm pretty sure if you're listening to this YouTube channel, you are not waiting. So the 16 preclinical bacteria species Dr. Fernando identified change years before cognitive decline and when intervention is the most effective. As always, start your interventions as early as possible. Don't wait for symptoms. Don't put your head in the sand. You can fight that. Fifth, advocate for biomarkers testing rather than waiting for specialist appointments. As Dr. Bengo showed, a 462 days delay could mean missing your treatment window entirely. Blood biomarkers like p-tau217 are becoming increasingly accessible and can identify pathology just as accurately as specialist assessment. So with 64% of referred patients showing positive biomarkers regardless of whether they saw a specialist first. Right, speaking of taking action, this is exactly the kind of cutting-edge research we analyze daily in the Phoenix community. While academic conferences happen once a year, the science keeps advancing and we stay on top of every development that matters for ApoE4 carriers. If you are finding value in this research translation, please subscribe to this YouTube channel. It really helps us, help me reach more carriers who need this information. But more importantly, consider joining us at the Phoenix community where we turn these insights into personalized action plans. All right, and I want to conclude that your microbiome is linked to your future. What these 5 researchers have proven is that the trillions of bacteria in your gut aren't just passive residents, they are very active participants in determining whether you develop Alzheimer's through metabolite production, immune modulation, and direct neural signaling via the vagus nerve. And unlike your ApoE4 status, which we can't change, your gut microbiome responds dynamically to every meal you eat, with measurable changes occurring within days, weeks. The convergent evidence from cardiovascular health metrics, brain imaging, biomarkers, and metabolomics all point to the same conclusion. Dietary intervention through gut microbiome modulation represents one of our most powerful and accessible tools for prevention. For those of us carrying ApoE4, this research offers both sobering reality and genuine hope. Yes, we have different gut bacteria with fewer protective species, and I actually wonder why, but we face higher risk with earlier pathology onset. But we also now know exactly which bacteria cultivate. So if you forgot, it's the Eubacterium, Oscillobacter, Lactobacillus, and Bifidobacteria. Which foods to emphasize? Berries, leafy greens, fish, limiting sweets and dairy, and which biomarkers to track. So p-tau217, GFAP, NFL. The question isn't whether your diet and gut health can impact your cognitive future, because these studies definitely prove they can. The question is whether you start making these changes today while your interventions window is still open. Yes, it's way more difficult to fix your diet than taking a pill or taking an injection, but these lifestyle interventions don't have any negative side effects. These are exactly what I call the no regrets move. You will not only protect your future, but you will also feel better on a day-to-day basis. So I really believe it's worth investing time and energy to fix your diet if you haven't yet. So your gut bacteria are listening to every food choice you make. What message will you send them today? That's it for today. My name is Kevin, and I'll see you in the next video. Bye.